Right, and we want to speak to Aggrey Aluso, who is a Technical Officer, Policy and Advocacy from the National AIDS Control Council, of course, on this day. Thank you very much, Aggrey, for joining us this afternoon. I think the question is, the HIV and AIDS has been with us for about 31 years. And the question would be, what strides have we made? Where are we as a country right now?
Thank you very much, Betty. Like you have said, we've had HIV with us for the last 3 decades. And I think as we commemorate the World AIDS Day, it's also good to reflect on the monumental gains that we have made in the fight against HIV. One gain that I must mention is the fact that we've been able to reduce infection among children by 44%. From 2008 to 2012, significant reduction by 44%. We've also been able to manage a reduction in the prevalence amongst the adults by 8% from the year 2008 to 2012. I think also another significant gain is the number of people being able to put on antiretroviral therapy, which is a vital treatment that helps in suppressing viral load. This has helped us avert over 460,000 possible deaths amongst people who are infected with HIV. So those are very, very important gains that we have made. Even though we still have a lot of challenges, Kenya is still ranked number 4 in terms of the global epidemic burden of HIV epidemic. Burden of HIV, coming after South Africa, India, and Nigeria, which have very huge populations compared to ours.
Right, and where can we say we're still having, the larger number of new infections?
Thank you very much, Betty. I think we are having significant variation in terms of populations, as you've been informed from that clip that you ran previously. We have a national prevalence which has reduced significantly from 2008 from 7.1% to 5.6% in 2012. However, we still have huge regional variations, like in the Nyanza region, particularly Homa Bay, Kisumu, Migori, Siaya, Kisii. We still have high prevalence rates of HIV. We also have certain populations, particularly amongst a group of population we call key populations, who still have significant high prevalence of HIV amongst them. These are people like sex workers, men who have sex with men, and people who inject drugs, still have huge, high prevalence of HIV amongst them. And those are the areas we're now putting a lot of emphasis on. We also have adolescent and youth still having high burden of HIV. 29% of all new infections in the country are found amongst people between the ages of 15 and 24. And also coming down to the gender divide, we find that 21% of all new infections, adult new infections, are amongst girls aged between 15 and 24 years. So we have made a lot of efforts to let science guide our work, to be able to isolate populations instead of going all out with one-size-fits-all kind of interventions. We are trying to granulate and be able to pick out which populations are adversely affected, and therefore coming up with targeted interventions which are able to respond to the specific issues affecting those particular population cohorts.
Right. Aggrey, there you mentioned a very 15 and 20 year age bracket. Does that concern you? Does that particular bracket concern you, that that's where you have more infections in the adults bracket?
Yes, as you have probably been hearing lately, we have a huge concern about HIV and AIDS amongst adolescents and youth. We have significant, new infections. Like I said, 29% of new infections are amongst the adolescents and youth, which is, corresponding. Initially, we've known that we have about 16% of the adolescent, youth and adolescent comprising our national prevalence. 16% of it is comprised of the adolescents and youth. But now we are seeing a trend where the figures are most likely to go up. because we are seeing a consistently high number of new infections happening amongst the youth, and equally high number of deaths. In Kenya, for example, it is estimated that about 9,000 deaths occur amongst adolescents annually as a result of HIV and AIDS. And we have about 72 new infections happening per day amongst the adolescents and the youths, and that is a huge number. And we are really putting a lot of efforts, and the theme of this year's commemoration is actually targeting the youth. We want to end AIDS and stigma amongst the adolescents and the youth, because that is where a lot of new infections are happening, and particularly the youths who are female. Because of societal factors, we've seen a huge disparity in terms of the burden amongst the girls compared to the boys. Not saying that the boys are better, but we have seen a significantly higher proportion of girls affected by HIV compared to the boys. And this is one area where we are really putting a lot of emphasis on. If you can remember in the recent past, a strategy to accelerate interventions amongst the adolescents was launched by His Excellency the President. And we are very happy with such high-level political commitment, because we're really going the direction where we can be able to pick out certain population segments which we have realized have a huge, we have strong correlation with HIV, and be able to support them to come out of this vulnerability as a result of the structural factors that we have identified are affecting them.
Aggrey, I'm curious, what would be the underlying reason for the infections, especially in the adolescents category? Are we talking about lack of information? Are parents talking to their children? Is there an information gap such that we're seeing this kind of numbers?
Thank you very much. I think, what you've said is exactly one of the concerns we also have, that the level of information that the adolescents and the young people are exposed to is not adequate to help them have that capacity to be able to make informed decisions about their sexuality. You've heard about whenever we have debates about sex education, there are a lot of conservative attitudes which people tend to say that, oh, we should delay it as much as possible, which probably is where we are not getting it right. What has come out clearly is that the age of sexual debut, the first sexual encounter amongst the young people is much lower than we actually appreciate. I think a recent study showed that 1 out of 5 adolescents or people between age 15 and 24 years reported that they had their first sexual encounter before they were 15 years. And therefore, education about sexuality and how to avoid risk of HIV needs to come in much earlier. And I'm afraid sometimes our institutions are not well prepared to deliver this kind of information. And I think that is where we are really putting a lot of emphasis now, so that we come up with age-appropriate information that can be able to target different age groups from very early ages, to the adolescents, so that they're able to know how to avoid, the risk of getting HIV.
I agree. This issue obviously is quite wide, but taking the conversation forward, let's talk in terms of the drugs, the ARVs. Are we seeing the availability become better, and are more people able to reach these drugs countrywide, considering some of the funding that has been put in place by different governments?
I think as of now, we still have a fairly good distribution of the ARVs. I can say that most of government facilities in different regions of this country have, are able to, sustain the local population who are in need of the ARVs. I think the big question has been demand. People who should be on ARVs or on ART, not, coming up and taking up the services because of the issues of fear, stigma and discrimination that had been talked about earlier. But of course, the issues of cost in the long term are things that are being discussed at a bigger, higher level of the government. We are currently talking about, issues of domestic, having a domestic financing mechanism so that we rely less on external funding. And I think this is a long-term thing. And everybody supports that kind of call, that we need to have our local resources to be able to sustain our people on this necessary medication.
Right. Aggrey, maybe finally, you know, there was a time that, you know, the campaign to have people get tested was intense. But are we seeing right now Kenyans, you know, going voluntarily and getting tested for the virus?
Thank you very much. I think one area where we've made significant progress is in terms of testing. Even though we still don't, we have not hit our target of having 90% of Kenyans tested, we have, I think currently, the latest statistics show that about 71% of Kenyans are aware of their HIV status. You know, compared to, you know, 34% 5 years ago. That is significant progression. Also, a significant progression has been in terms of people who are HIV positive, you know, who are aware of their status. You know, rising to 47% by the year 2012 compared to, you know, 16% in the year 2008. So that has been significant also, because when people are aware of their status, they're able to take appropriate measures in terms of, you know, seeking appropriate care and treatment, as opposed to when they don't know, they would be living with the virus and probably spreading it without knowing. So yeah, yes, we have made significant progress, but there's still a lot of room in terms of our targets. We are targeting to have at least 90% of Kenyans knowing their HIV status. And of these 90% who know their status, 90% of them should be enrolled on care and treatment. And of those 90% who enroll on care and treatment, 90% of them should be retained on that care and treatment and receive, you know, viral suppression medication. Because this is one way of also reducing the spread of HIV. When people are on medication consistently, they're able to, you know, the risk of spreading HIV is also greatly, you know, reduced.
Right. Thank you very much, Aggrey Aluso. As I mentioned, the subject is quite wide, and of course there's a lot to talk about, but of course the fight continues. Thank you very much, Aggrey Aluso there, who is a technical officer of policy and advocacy at the National AIDS Control Council, speaking to us on this very day that we talk about HIV and AIDS infections in the country, where we are, where we have been, and of course where we are going.